Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard, you don't know where to go. Everything keeps falling apart, yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff. It's a pleasure to be with you again tonight. And many of you have been asking, how do I avail myself of all the previous episodes? It's very simple. Go on YouTube, A Time for Truth show, click on the subscribe button. We'd love to have you as one of our subscribers. And tonight, we have something that's extremely important for all our communities that's actually affecting so much of the country. And engineer, if you can put the first image on the screen, we're going to start immediately because we're talking about something that actually is a sobering reality. The fentanyl crisis. And it's continuing to impact families, communities across the entire United States at an unprecedented scale. To give you an idea, about 80,000 Americans lost their lives in 2024, and that represents over 217 deaths every single day. But more importantly, behind every number is a person. There's a father, a mother, a child, a grandchild, a neighbor, a friend. And all of these had their lives end too soon. Drug overdoses remain one of the leading causes of death from ages 18 to 44. And that crisis affects every demographic portion, every economic portion, every community in our country. And what do? Do we resign ourselves? No. We're going to take a look at how we can educate, preventive efforts, community collaboration and outreach, and how to save lives through those actions. In 2023, nearly 69% of all overdose deaths were synthetic opioids, specifically fentanyl, an extraordinarily potent opioid that is often hidden in counterfeit pills and gets into other drugs without you ever really even realizing it. And that's why it's so important for us to have this show tonight and to educate. Let's go to the next image, engineer, because we need to avail ourselves of all the educational possibilities, community resources, treatment resources, and stop this fentanyl. But let's take a look at first, what is fentanyl? Well, fentanyl was actually developed for treatment of severe pain in a hospital setting for cancer patients, being monitored by physicians. Very strict guidelines. But today's fentanyl is not that fentanyl. It's synthetically, illegally manufactured and put out into our communities. It is something that is mixed in different drugs, in different compounds, and someone may think that they're taking a certain drug when in reality it's laced with fentanyl, which is causing death, and which makes fentanyl even more dangerous because it's 50 times stronger than heroin. It's 100 times more potent than morphine. And tiniest amounts cause life-threatening consequences. A person may think they're taking something that's just going to get them a little high, but they die. This is very important because our young people, our youth, who have not really been exposed, will die instantaneously from that fentanyl. Very little time to react without immediate intervention. And the key really is simple. Fentanyl is dangerous, and we need to know, what do we do with this crisis? Well, let's look at the next image, and let's look at how rapidly fentanyl-related overdoses have increased in the United States over the recent years, and how prevention is beginning to make a difference. If we look at that graph on the screen, you can see the rise that occurred from 2018, where we had 28,000 deaths, to 2023, where we had really about 113,000 deaths. And this was due to the increasing augmentation and appearance of fentanyl into our communities across the United States. At the same time, we want to give the positive side and the hopeful side, because the Center for Disease Control data demonstrated that deaths declined to about 80,000 in 2024, nearly 27% decrease. And why? It's important to look at that. Education, community outreach, collaboration, and more resources, more services. Very, very important. So we made significant progress, and we need to continue to do so, because every life could be the life of your loved one. Fentanyl remains a threat, and nearly 69% of overdose deaths are from synthetic opioids. And what are we talking about? Really, fentanyl. One of the leading causes of death from 18 to 44 years of age. Let's go to the next image, and let's take a look in this image about the risk, because fentanyl is involved in the majority, as we said, of the overdose deaths. And in 2023, about 69% involved fentanyl. Secondly, many people have no idea that they're actually consuming fentanyl, because it's mixed, as we said, in counterfeit prescription pills, other street drugs, things that the person buys from a trafficant. They have no clue. Thirdly, mental health challenges such as depression, stress, anxiety, trauma contribute to substance misuse. The person is feeling down. They're looking for a solution. Unfortunately, they may turn to a pill and die, not realizing that they took a counterfeit prescription pill laced with fentanyl. Fourth, fentanyl, very important to realize that if it's mixed with alcohol, with marijuana, with cocaine, with methamphetamine, crack, other drugs, have deadly interactions because of the potency and the augmentation being increased, so that that person now is exposed to much higher levels and they stop breathing. And finally, it's important to realize that our young adults struggling with opioid dependency already are particularly vulnerable. Why? Because as I told you, it's not like a drug addict who maybe could take the fentanyl and they're already used tremendous opioids that they're taking, heroin that they've taken. Their body has acclimated. But with a young person, this is not so. Very important to educate our youth. The message is clear that we have to educate, we have to have community services and outreach, and we have to collaborate. Get this message out in families, in schools, healthcare offices, community organizations, churches, whatever. Let's go to the next slide. And let's take a look at something that's important to realize, that overdose warnings, because most people assume that an overdose happens suddenly without warning signs. But it's not true. We have to realize that one of the first warning signs is lack of alertness, or reduced alertness, where the person is drowsy, where the person drifts in and out of present time and doesn't really respond. Their speech can be slurred. They can have confused speech, difficulty communicating. Their movements become slow, uncoordinated, lethargic, weak. They are unsteady. They struggle to stay awake. But the very important sign is if you see their breathing slow, if their breathing is changing and decreasing, it's very important that we give them immediate attention, stay with them, keep them awake, keep them talking, and act quickly when you see these signs. Don't ever doubt yourself. Let's go to the next slide. Let's take a look a little more about this overdose emergency happening, because every moment is important to save that life. The warning signs, again, of the alertness, the slurred speech, the problem staying awake, the unsteady movements, all of these, especially the respiratory failure, stop breathing. We need to call 911 and let that dispatcher know exactly where you are. Don't leave the person. Get 911 to help you immediately. If you have Narcan or Naloxone, what you can do is implement that immediately, take it, spray it in the nostril. If it doesn't work in a half minute to a minute, you can spray it again in the nostril. You won't have anything negative that you're happening. You're not going to harm this person. You're helping the person. Sometimes with fentanyl, it's very, very strong. Now there's a new fentanyl called Carfentanil, which unfortunately is even 100 times stronger than the fentanyl. So sometimes you have to give quite a bit of the Narcan. And when that person comes to, realize that the effect is not permanent, because the fentanyl will last longer than the Narcan. And it's very, very important to get that person to the healthcare professionals, to a hospital, into that ambulance. So let's look at the next slide, because the drug crisis is not just a public health issue. It's actually affecting families, communities, brothers, sisters, friends, all over the country. In fact, President Trump stated, drug addiction has devastated American families, ravaged our communities, destroyed far too many precious lives. And President Trump's words reflect what millions of Americans have experienced, unfortunately, firsthand. The emotional heartbreak, the familial breakup, the community effects as people in community realize what's happened. The loss of someone maybe who had a stable position in that social structure. The economic and financial hardships that then are encountered by the family that remains. All these facts. Children that lose parents, parents that lose children. We need to stop this. We need to realize that something needs to be done, and that every person educated is another person that we've salvaged from a future of possible untimely overdose death. Let's go to the next image. And while we can see that enforcement and treatment are important, the most effective way is to prevent it in the first place. Let's educate. And it's very interesting because during Super Bowl 2026 in San Francisco, volunteers from the Foundation for a Drug-Free World distributed 1 million Truth About Drugs scientific educational booklets throughout the San Francisco Bay Area. Let's go to the next image. And here you see, some of the results, some of the people. The results were really unbelievable. As in San Jose, they experienced 116 fewer drug and narcotic offenses in February, representing a 30% decrease compared to the previous month. And in San Francisco, overdose-related weekly 911 calls declined by nearly 8% from the immediate pre-campaign period and were approximately 35% lower than comparable levels that were reported the previous year. And these results show that, as you see on the screen, the community activities, the outreach, the education plays a meaningful role in reducing these drug side effects, consequences, overdoses. Let's go to the next image. And, what is possible? What can be done? What should be done? Well, there's a positive role the community leaders, volunteers, and public education officials can play in preventing this. This happened in San Francisco, where former NFL players Marshall Faulk and Nick Ferguson worked alongside the Drug-Free World volunteers during the Super Bowl to get the message out on the media, at the game, to the spectators who were walking, to the shops in the San Francisco Bay Area. They saturated the area to get those results. And why did these famous NFL players do so? Well, because they realized that we need to work together. This is really going to take a team activity, and we need to win the Super Bowl of not having such fentanyl overdose deaths, such illicit drug deaths, the cocaine deaths, the heroin deaths. We need to put an end to that game and win the Super Bowl of life. So together, they came and organized and decided to do this in the San Francisco area. And so this campaign, the Truth About Drug educational campaign, if we go to the next slide, there we go. Now you see it on the screen. Contains booklets, contains public service announcements, and encourages people to speak to each other. Because if you speak to a youth, to a young person, many of them will then think twice and make the right decision to not take that drug, to not succumb to the peer pressure. The message is simple. Knowledge empowers educated, positive decisions. And this is so crucial before the exposure to drugs. Every student we educate, every family we protect, every community that we engage represents an opportunity to decrease this number that's grown so much since the COVID pandemic. And so if we go to the next image, please, engineer. This is a beautiful slide for us to end on. And this is really what we want to look at, because there's an important message. Recovery is possible, but requires commitment, discipline, and help from other community family members. And they need resources for those who are already afflicted. And we need the cooperation of the society. In fact, the National Drug Control Strategy focuses on reducing drug trafficking, preventing substance abuse, and supporting long-term recovery efforts throughout the country. And one of those initiatives is the HIDA program to find out where we need to focus through statistics and sharing intelligence. Another one is drug-free communities, where we do what we did in San Francisco, and we promote broadly to get local coalitions working together. And in San Francisco, we had shop owners, citizens, athletes, professionals, educators, everyone. And you saw the results that I mentioned earlier in this program. All these programs are grassroots, and the strategy is crucial. But really, what does it come down to? Because as we near the end of this program, we return to a very simple but powerful truth. Drugs, especially fentanyl, kill. Let's not cry at the cemetery and at the gravesite. That death could have been prevented. We could have implemented a program like the Foundation for a Drug-Free World in 18 languages, free of charge at drugfreeworld.org. Because every life can be saved with that education. There on the screen, you see the two links where you can download material for free, get public service announcements, drugfreeworld.org, vidasindroga.org. Every year, thousands of people, especially our young people, face peer pressure and the risk of those drugs. Let's save their health. Let's educate them. Let's protect the future of our country and the future leaders of the United States of America. Let's heed what the President of our country has warned us on and promoted, that we educate, that we get the community involved. Because when young people receive accurate, fact-based information before they're exposed to drugs, they are far more likely to make informed and responsible decisions. And now I want to play you a video from Drug Free World and hope that you enjoy it. Here we go.
Nearly half of all public school children in the United States have tried drugs or alcohol by the time they're 13 years old.
A third of teens have gone to house parties where there was alcohol, pot, cocaine, ecstasy, or prescription drugs.
Over half of kids say it would be easy for them to get pot if they wanted some.
7 out of 10 teenagers have been offered an illegal drug.
Teenagers whose parents talk to them about drugs are 42% less likely to use drugs.
Get your kids the truth about drugs. drugfreeworld.org.
So there, you had one video, and now we're going to play another one for you. There's actually about 16 in all. They're very hard-hitting. I would encourage you to look at them at drugfreeworld.org. And here we go with the second video.
They said one hit wouldn't hurt. They said one hit wouldn't hurt.
They lied. Get your kids the truth about drugs. drugfreeworld.org.
They said drugs would make you cool.
Go in my room.
I just asked you.
No, Mom, shut up, Mom.
Tell me to shut
Leave
up.
me alone.
Get back here. Stay home.
Just say it to my face, dude. What? Just say it, dude. What? No, man, it's my face.
What's wrong with you?
Man, forget you guys.
Hey, wake up, sleepyhead. Pay attention in my class.
They said drugs would make you cool. They lied. Find out the truth about drugs. drugfreeworld.org.
So there you go. Another of the impactful public service announcements from drugfreeworld.org. And here you see, as I had mentioned to you, and let's take the example of Nick Ferguson and Marshall Falk and those community volunteers, because our giving knowledge empowers individuals to recognize the risk of illicit drugs, and especially this fentanyl, which is so powerful, and this new Carfentanil, which is even more powerful than fentanyl, is very, very dangerous. So let's prevent, because prevention is better than intervention. And when we have to intervene, let's intervene. And let's move forward, because intervention is better than tragic death. The future depends on the choices we make today. So let's make it a future of hope and action. And let's provide material so that we can educate and so that we can get this material out into the world. Presently, 55 million booklets were distributed across 180 countries in 20 languages. Let's not stop, because when people understand the facts, they're better prepared to protect themselves. So whether you're a parent, a teacher, a coach, a doctor, a lawyer, a community leader, you have the power to make the difference. Every conversation, every conference, every young person we reach matters. Every life we protect. Let's do that, and let's look at this day, June 2nd, 2026, my birthday, as the day when we decided to put an end to illicit drugs. Thank you so much. I hope you've enjoyed the segment. Let's make a drug-free world. Good night.
This show was sponsored by Atimefortruthfoundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet